Hey, I'm back again. Matthew McKenzie, Carer Activist, ready to do another lecture on raising care awareness. And I feel this is a really important topic today because it's a tricky one. When it comes to caring for someone with mental ill health, we think as family or carers, mental health or mental illness is just restricted to the patient, to the person that we're caring for. And to a point, you're right, really, because the worst that someone's got off of that with mental illness, it depends on the type anyway, is someone who's in desperate need. They've reached a crisis. There is another side to that story. We all have mental health, and there are all different levels of mental health. What is witnessed amongst families and carers can have an impact, and I will describe a bit more about this in today's lecture. Hence, trauma. Um, so the title, as you can very well see, is "What is Trauma and its Effects on Carers or Those Caring for Someone with Mental Health." When I say mental, I'm sort of being more sort of correct, really, if you know what I mean. Most of the time, I'll try and refer to as mental ill health or mental illness. But I know some people call it mental health, but I just want to be exact on what we're sort of talking today. And it's going to be a journey into the complex effects of mental health and the impact on the family. But to be honest, it's more on the impact of trauma and why carers, not just mental health carers, even though some of the things or most of the things I mentioned will be commonly referred to what mental health carers experience. Now, I myself can say that I have forms of trauma um, due to the things I've experienced as a mental health carer and still trying to provide support and care. But this thing is actually a complex issue. It really is, because unfortunately, what we see in the mental health system is a rush, and mostly correctly so, a rush to support the patient, not sort of often realizing the effects of mental health on the carer. And I'm not trying to say who's suffering the most. I think that's the wrong way of looking at it. It's not a competition. I'm just saying the impacts and to be aware of them. So let's start really. I mean, what can we say? What trauma is? What is it? So basically, the pictures you see here is, I would say, basically carers. To be honest, they are concerned about something, but why? Well, I'm going to try and give around about 20 or so experiences that can be traumatic to a caregiver of someone supporting someone with mental ill health. But as a reminder, there's two things. This doesn't just affect mental health carers alone. It can be a situation nearly all unpaid carers can have experience of. Trauma is just the one sort of thing carers can go through. There's a multitude of others: depression, forms of anger, um, the effects of isolation, anxiety, and I'll cover that at later dates. But trauma is one of the most common because it's something, I think, really, if it's not at higher levels, carers will just cope with and just say, that's it. We'll have to just deal with what we got. But what is trauma? Trauma is an emotional response, I should put that in bold, emotional response to a stressful or dangerous event that can cause lasting physical or psychological harm. Now, I'm actually going to be focusing on the psychological impact because that's what I've noticed, not only myself, but many other carers and caregivers that I come into contact with, whether it's from my groups, events, one-to-one support, or following up on them. The situations that can affect a person's sense of safety, self, and ability to regulate emotion. So they can come on at any time because of the events you've experienced as a caregiver. The other thing I want to mention, which is very important, is that this topic can be distressing. So if you feel at any point you need to turn off or anything like that, and I do understand, feel free to do so. So it's just a warning. Although to be honest, I think those watching this video have a fair idea, have a fair idea, what I'm going to be talking about. But the experiences here can be triggering because if you're a caregiver of some, mental health or not, you, you might recognize it and feel like, yeah, I've been through that, and it'll sort of creep in. I will, as promised, follow up this video with ways to combat trauma. It's not easy. The longer you've been through it, the more you probably should just develop a thick skin and just get on with it. But it's not the best way to go about this. So let's continue. List the trauma list that affects carers or mental health carers. So the first thing really is, and this is dependent on the type of mental ill health, because not everyone will experience a loved one with those symptoms, but witnessing self-harm or witnessing your loved one going through suicidal behavior. Now, seeing a loved one engage in self-destructive actions can be profoundly distressing, may lead to feelings of helplessness and fear. Now, you can see from what I've mentioned, almost a double blow, because those who are seeing someone going through that will often feel helpless. They feel anxious that that person, could be seconds, minutes, or whatever away from harming themselves or taking their life. It's a difficult experience, and this is something that can eventually lead to trauma because it's something that will be ingrained in that person's mind, for life unless they do something about it, which I will follow up in another lecture. So that's one type of thing. Not, I won't say this is a situation all mental health carers face. And it doesn't have to be just self-harm. It could be watching a loved one who's in the grips of psychosis run across the road or walk out the house at night, not knowing where they're going. And you can see that there's a high risk factor. So if that's a traumatic event, you're not sure what will happen to your loved one. The other thing is handling and verbal and emotional abuse. Now, this can be more common, really, if you come from mental ill health. Mental illness can sometimes lead to outbursts or challenging behavior that may include insults, threats, or forms of emotional manipulation, which can actually wear down the caregiver over time. Now, I can say for certain, I've certainly been through this for many years, and wasn't sure how to deal with it. And I don't think many other carers out there, unless they have a well-resourced mental health service or are lucky to have a care support officer who knows about these things, you wouldn't really be trained. So you wouldn't know the difference between, is this a family argument or is this the mental illness that the person is going through that's speaking in this way. But the key word here is that it's wearing the caregiver down each time there's a verbal abuse or challenging behavior, and quite common in psychosis or schizophrenia, that they become suspicious or angry and may often lash out. And the more this happens, the more this will create forms of trauma, because that's how you begin to feel, how you remember that person, how your loved one became so unwell. Feeling a state of constant hypervigilance. So being on high alert for signs of a crisis or relapse. And if it's something that's happening constantly, if your loved one's relapsing fairly often, it will lead to forms of chronic stress, anxiety, and sleep disturbances. You feel like you just cannot sleep. This is heightened if you're obviously living with, your loved one who is going through chronic forms of mental ill health. And if you're on hypervigilance all this time, then yes, you will begin to be worn down and will begin to develop forms of trauma because you're always on alert. And it's only sort of for short bursts of time, it's tolerable, but for long lengths of time, it will have a severe impact to the caregiver's mental health. Let's continue on to this one. Now, this is more serious because this is not just trauma, this is more than that, experiencing physical aggression or violence. Now, some carers may face physical aggression, which can cause trauma, especially if they fear for their own safety. Now, if you're a carer actually going through this, it's so important you let professionals know because it's for your own safety. And, it's understandable you're trying to care for someone who's going through severe mental health, but it shouldn't be at the cost of your own health, safety, and well-being. So do raise this issue. Unfortunately, there's a situation that many carers do go through. And yes, this may change over time, perhaps for the better, perhaps the loved one will recover from performing forms of aggression or violence. In fact, I'm going to go a bit further. Some, unfortunately, are very unlucky. Some carers have, unfortunately, died from this situation. But we're not going to be talking about that today. We're really going to talk about the forms of trauma. This is something that doesn't really easily go away if someone experiences physical aggression and violence. And yes, it can cause trauma. So we'll continue on. So let's continue. Then the next set of forms of trauma and examples of how mental health carers or carers can develop trauma is experiencing financial strain, oddly enough. The cost of associated with care, treatments, or loss of work over time can cause financial pressure, adding another layer of stress. Now, I think this is very common, to be honest, especially if either your loved one's working or you're working yourself. Something's got to give if there's repeated forms of relapse or the actual form of mental ill health requires the carer to be on hand for a long length of time. And this is another added layer of strain and stress because you're always worried about not just your loved one, but the financial impact. As usual, I would always say when it comes to carers assessment, certainly to get one, as this can be raised, what forms of protection can be put in place. But yes, this can lead to trauma. Another thing really is enduring sleep deprivation. Caregiving responsibilities can actually disrupt sleep, especially if the person with mental illness is active at night or needs frequent checking in. It can actually lead to exhaustion. So this is something that is not often, and I feel actually not often really recognized. Again, it really does depend on the type of mental illness you're trying to care for or that the carer is trying to combat. And it's not always mental ill health. This can be, again, physical health as well. But if the carer or caregiver is constantly having to check, and I've experienced this myself with my close relative, they just would not or could not get sleep at night. They just couldn't. They were having too many nightmares, hallucinations, and they just were screaming. In fact, one of my poems in my books, because I'm a poet, does describe that scenario. And this was for several nights. I was trying to raise this as an issue, but it's fallen on deaf ears. So until my loved one did finally relapse, things slightly got a little better, but it was for a long length of time. This isn't always the case if your loved one isn't known to the mental health services or the services are struggling to support the person you're caring for and yourself. With that exhaustion, your mental state is at risk, and yes, it can be very traumatic. I still have thoughts about the situation where my close relative just was screaming at night due to her becoming really unwell. So yes, that's another form of an example of forms of trauma, of sleep deprivation. And the thing is actually dealing with personal trauma triggers. Now, kids actually have their own trauma histories, which may be traumatizing by the challenges of caring for someone with mental illnesses. Now, the reason for this one really is if your well-being wasn't good to begin with, discrimination actually points to mind when it comes to my own personal trauma triggers. I've been for a lot of it, and I can see the outcome of that on my close relative when she developed mental ill health. So if I wasn't in the best state, previously, seeing someone else going through forms of psychosis can make that even worse. So I've already had forms of trauma anyway, and that was even made even more difficult. This is different from caregiver to caregiver. Some might have personal trauma histories, others not so, but it's something to take note of. The next one is feeling powerless during a crisis, actually watching someone you love suffer. The key word here is suffer. You're watching them suffer without being able to relieve their pain. It can be deeply traumatic, and create a sense of helplessness. Notice helplessness is a key word that I've mentioned a few times. So, to be honest, no one's really trained. Mental health carers, and I think this affects all carers. This one, we're not really trained um, regarding high levels or forms of ill health. You actually do love that person, you know, I could say for most part. But when you see someone you love actually suffer for a long period of time, for many years or so, it can cause forms of trauma. Um, and I'd advise carers. Now I can really say to a carer, say, "Oh, well, you don't have mental illness," or forms of that. Mental ill health, it's got to start from somewhere. It can't just be your identity, you're either mentally ill or not. It's got to be something that's usually forming. And then if not supported or checked upon, bang, it will spark. So it's important to get that sort of support before it gets out of control. And one of those things, unfortunately, is if you do see someone you love going through something traumatic, something really painful, distressing, then yes, your mental well-being will take a knock. I'm not sure if that's the best way of describing it, but it's the feeling of helplessness and feeling powerless in regards to helping someone. It's not just, at that point in time, it's got to be, I would say, a long period of time, and it wears your mental well-being down. So let's continue. Next one is actually navigating stigma and judgment from others. So caregivers actually, unfortunately, may face stigma, blame, or misunderstanding from family, friends, society, which can be isolating and discouraging. Now, this is something again I've experienced quite a few times, to be honest. There is unfortunately this divide, not from everyone, but there's a situation where I suppose I'd say militant. Really, there'd be others that judge others to say that no, they're suffering more than the other person, and I think that sort of example or behavior is very destructive. It's not an inclusive scenario that those who are working in the mental profession should take. But unfortunately, as it stands, this is something that still happens. It's not just between caregiver and patient. I've seen this between patient and another patient. A patient will say, "Well, you don't have mental ill health because I suffered more than you, so therefore you do." That sort of nonsense. Do you see what I mean? So at its best, mental illness is a very complex form of trying to understand how someone's well-being, mental well-being is suffering, is as a form of disorder, would say. We all have mental health. It's whether we are aware of it. But it's not just that, it's what we pay attention to and how we carry ourselves. So there's this divide, there's this stigma regarding judgment from others. You're the carer, so you're obviously got to be the strong one and try and understand what you're trying to care for. But that can't always be the case. We've now been through severe forms of mental ill health. But who's to say it doesn't impact our mental health, which it clearly does. So as it stands, there is a lot of stigma on mental illness. It's changing for the good, but there still is a lot of stigma regarding mental ill health. And it's not just from those who've not been through it, it's from those also who have been through it and still misjudge others. They've not sort of learned, or perhaps can't. It's jury's still out there on this one. Can't sort of make that connection that mental health is something we all have. Mental illness, I agree, something that not everyone has, but it's got to start from somewhere. That's my thoughts on it. You can't just say you have mental health and you don't. It's something that comes on. But what's the cause? And one of the causes actually is a constant wearing down of someone's mental well-being. One form of that is judgment and stigma, blame, misunderstanding, isolation, pointing out things that perhaps the carer has no control over, or they're sort of thrown into that situation. No fault of the patient, not fully, depends on the mental illness. I would say society at large, and a lot of work to do regarding the mental health profession. But as it stands, there's still a lot of mental health stigma out there. There still is a lot of form of judgment, a lot of forms of calling out. You will get that. And carers and caregivers are not, I don't know the best word for it. It doesn't discriminate. There will be targets as well. And there will be blame, because a good example, I suppose, is if your loved one relapsed and became unwell, and there will be some professionals perhaps to say, well, it's your fault. Why weren't you there to provide that support? So you may get a bit of that. And also you will get, I've experienced this a lot, funny talks in the street. Oh, that person's looking after that mad person. Or did you see, this is a common one actually, regarding cultural perceptions. Those from ethnic backgrounds may try and keep things a bit more quiet because they feel that their family is judged, because they have someone in the family that is perhaps going through a mental ill health situation, and they feel others out there may blame a family member, perhaps the parent, to say you're not looking after your family properly, you're not putting your foot down and trying to control that person's behavior, when it's not a behavior problem, it's more of a mental ill health. So this one's a very tricky and complex one. But then over time, because of this, over time, and it's not a focus on carer mental well-being, that will wear down the carer or caregiver. So it's a very tricky one. Obviously, I'm not saying the patient or service user is not suffering. They are, and they need the most support. The situation is that as your role as a carer or caregiver, you're sort of almost trying to throw yourself into that situation. And the reason because of that is because the resources are not often there. They can't be. So you might not fully have that choice. And I will revisit this at a later date, because there is changes to the Mental Health Act regarding these things. And I do think there are problems with it, because the way as things stands, the mental health system in the UK is not the best it can be. So no one's in a rush to literally care for someone unless you have a lot to lose, like your loved one. You don't want to see them suffer. So this is something I will revisit at a later date. But as it stands, it's the carer trying to navigate the stigma and judgment from others, and they are definitely not trained to do that. They're only trying to learn as much as they can regarding mental ill health before things get out of control. So that unfortunately can lead to forms of trauma. Another one is experiencing resentment and guilt. Now, over time, caregivers may feel resentment about their responsibilities, followed by guilt or feeling, that way, why they're feeling resentful about, their loved one, about the responsibilities that they have to do, which can obviously create a painful emotional cycle of trauma over the time. So again, it's a wearing down again, especially when it's relapse after relapse after relapse. You begin to worry, you begin to wonder, have I done something, wrong? Why is this happening? What have I doing wrong? Why do I keep visiting the inpatient ward, trying to work out what the professionals are trying to say? Whether it's, whether they're doing their job right, or whether is it me not being forceful? Um, so this one is very tricky. It's a tricky one to sort out because there could be many other things that can cause resentment or guilt. And this is going to be, again, a very triggering one, really, on what I'm going to say. If your loved one, unfortunately, had died, there'll definitely be caregiver guilt regarding the situation, because you feel to yourself, what if I did things differently in order for such a thing not to take place? Another one is witnessing cognitive decline or personality changes, like watching a loved one's personality change or their cognitive abilities decline can feel like you're losing them, which can be grief inducing and definitely traumatic. So it's like witnessing someone's, and again, it depends on the mental health. It's like witnessing someone's loss. You're losing, and a good example is, you're caring for a parent. You'd always feel that that parent has always had, they brought you up, they brought you into this world. They were strong, and they've done the best they can for you. And then, you know, they develop mental ill health, and you don't feel you're trained. It's a role reversal. So you don't feel you're trained to support them, and you're witnessing what was once a strong person, and they still are in their own way. They still are strong, but the character changes and the personality changes shows them that they're very dependent upon yourself as a carer. But you're sort of observing this and being part of that journey for a long length of time, and thus it can lead to a forms of grief, particularly with, and a good one is dementia. You're it's a not a it's a traumatic way of being on that carer's journey. Let's continue. Handling medication and medical side effects. Something again I've been through, obviously, but seeing a loved one deal with the distressing side effects of medication can be frustrating and traumatic, especially if the treatment is necessary but difficult. So yes, seeing your loved one perhaps sleeping and spending time in a room, days and nights on ends, and they're sort of losing their physical appearance and their physical health. And there's other forms of side effects with medication, and you're sort of thinking to yourself, what can I do? But again, you're witnessing the physical and perhaps mental decline of your loved one. And again, you're not trained. You can only pick up what you can from medication side effects. What makes this even more difficult is if you struggle to be more involved regarding medication. So you're not sure how to navigate to the professionals, what is the best sort of dosage or medication, because you're not a pharmacist. How would you know? So it's a split sort of second, I suppose, decision. You get that decision wrong, they could relapse. You get it right, then perhaps and you see the side effects, and perhaps even there's not much you can do about it. But the situation is, because you're not really trained and you're trying to sort of second guess things, but you can only see the distressing side effects, then you have to depend upon your judgment and what the professionals tell you. And again, if your loved one don't want you involved, is you're almost witnessing their decline. So it's a very difficult one. But and yes, this can lead to forms of trauma. So let's continue. I think I've got 10 more, I think, to go. I'm guessing I think it's 10. So encountering care system, and this is basically what I've just been saying. Encountering care system barriers or navigating the healthcare system, especially when it comes to quality mental health care, is limited. It's not. I'm not saying that it's not limited. It is. It can also be discouraging and traumatic for the caregiver who was actually trying to advocate for the loved one. I should include advocate for themselves as well. So yes, rightly so. The Mental Health Act needs to be revamped. Definitely, there's lots of recommendations that are sitting there waiting to be incorporated into the Mental Health Act, because there was a lot of situations carers and their loved ones were facing. It's too old. As it stands now, the mental health system is in need of a lot of changes, a lot of investment. It's very complex, and it is, as I mentioned, limited. Because of its being limited, I would confidently say families and carers are not in a rush to provide support and care. So in a sense, there should be a nominated person. There should be, but there are problems with this as well. I will go into this maybe 2 months' time. I'll look at this thing. And because the mental health care is limited, it doesn't mean that the nominated person is trained either. It's it's a matter of who's making the most noise. That's how I view mental health carers. Who is making the most noise? It's not a choice, or it's not like you do it and that's it by law. I don't think that's the best way of looking at it. Is who's making the most noise and why. But because the mental health system has barriers, and the big one is confidentiality. And there's times when it's needed. I absolutely agree. But then there's times it can be an excuse, and it can be blinkered as well, as you either face confidentiality or you don't, and that's it. And I think when you're dealing with mental health matters, it's very, very complex. The family structure is also very, very complex. Um, but the resources are not often there. So yes, one can change the law, but can one easily change the mental health system? And the jury's still out on that. Until the resources are there, there's only so much you can really do. So yes, encountering care system barriers as a caregiver and navigating through it without that much advocacy or training can be traumatic, especially, and I will do a lecture on this. I've got the presentation all set and ready, especially if a professional says specific things to the carer that puts them off, can be isolating, and can be traumatic. We'll continue on. Well, I keep jumping too far forward. Feeling judged by professional society. So what I've just said. Caregivers may feel judged by mental professionals or society, which can lead to feelings of inadequacy or shame. And yes, I've been through this, and I still actually go for it. To be honest, there'll be others that will judge me on what I don't fully always know or understand, which is right. Okay, these things I just don't know. This is not even my job regarding mental health care. Is what I've learned from, the keyword here is lived experience. There's always stuff to learn. But then unfortunately, within the mental health situation, there's not just professionals, it's actually other carers or even other patients or service users. They will feel the need to judge you on what you know, what you don't know, not realizing that you've come from a traumatic place or that you're going through it. And to a point, I actually can understand, why they're sort of doing it. They might not fully realize the impact of what they're saying. And I think this is more of a human situation. You can't often see, what a person has gone through until you've been in their shoes. Nevertheless, unfortunately, the situation as it stands is that can lead to forms of trauma, especially if you're trying to deal with that, you're trying to survive through it. It's really more hurtful if the professionals who are trained in mental health, they're trained in it, can begin to judge parents and carers. It might be due to time, they just don't have the time, or they're not being regarding case histories, they're not sort of being brought up to speed on that. So they might make quick decisions, not realizing the complex nature of the family structure and its impact of the mental health on that family structure. Society at large can also do these types of things, and that can lead to forms of trauma amongst mental health carers. And I'd take this forward to all forms of carers, but particularly mental health carers, because as it stands, mental health is not the most easiest thing to understand. So managing your own mental health struggles, again, not this might not affect all carers, but I think it's over time you will eventually get more forms of anxiety, depression, trauma, forms of anger, and caring for someone else's mental health can make it challenging to attend to personal mental health needs, leading to burnout or depression. So you even get, I'm thinking of labels actually. You can even get those who have their own mental ill health that have taken on the role of trying to become a carer. And it's going to be really difficult for them, obviously, if they're managing their own mental health struggles and now are trying to care for someone who has developed mental ill health. So the problem with labels as saying someone's a carer, someone's a patient, it doesn't do its justice on this particular situation. This goes back to saying we all have mental health. We can't easily be labeled as whether you're a carer or you're mental illness. You just don't really know unless you've lived through that person's situation. But there are others out there who have forms of anxiety, self-harm, eating disorders, OCD, that are actually caring for someone else. Very, very difficult. But then because they're trying to do that, that may add another barrier or another thing that's not doing wonders for their own mental well-being, and that can lead to forms of trauma. So facing reality of a lifelong illness, coming to terms with the chronic nature of someone you love or person that you're caring for their mental illness can be traumatic. Now, caregivers may grieve the future they've imagined and a deep sense of loss. So this is basically, you cannot get out of this. You know that in the future, it's a realization that your loved one's life is going to be short. You're just almost waiting for that scenario of when they're going to pass. So it's grieving before, and then eventually when that time comes, you're grieving after. And if you're grieving for that long, yes, it's going to be forms of trauma. So it's something, I suppose, where if you can train a mental health care to, you hint it, I suppose, if you have an idea that this is going to be a situation, again, dementia, and there's other forms of mental ill health, the anxiety of self-harm or someone going through suicidal tendencies. It's a form of lifelong illness. And this is actually common, not just mental health carers. You've got, again, forms of cancer. I remember I also raise awareness and do support for cancer caregivers, again, lived experience on my part as well. Let's continue. So, on to the conclusion. These experiences can weigh heavily on caregivers, making it crucial for them to access support, self-care, and mental health resources to in a process and cope with the trauma they encounter. And I would say confidently, if you're care, not just mental health carer, and you're caring for a lifelong illness, you will experience some form of this, some forms of trauma. But it's so important for yourselves as carers to access support and self-care. Don't just leave it. What makes it really difficult is I don't think it's brought up enough when it comes to engaging, getting support from the mental health system. You're not really trained to recognize an attack on your mental health. You might just put up with it. I always say to carers, plan ahead. learn how to lessen that damage of trauma. I don't think you can avoid it. You can lessen the damage. I will follow up this video, this lecture on ways on combating trauma. A quick final word on this: trauma is just not the only thing carers and caregivers can go through. But what I've just explained is just a list, and not everyone goes through this. It's a list of examples of what carers and caregivers can go through regarding forms of trauma. I say, if you like the video, leave a like. You don't have to. I'm quite fine doing lectures without that. And also, subscribe. Trying to continue lectures in order to raise care awareness and the challenges. And also, it's not always about battling and challenges. There are many great and wonderful things in the role of caring for someone you love. But we can't be naive to say that there won't be challenges and problems carers will face. Thanks for watching, and I'll see you again soon.